film tells the story of how almost the entire population of the city of Kingston upon Hull was vaccinated against poliomyelitis. When the outbreak began, there was no indication of how serious it might become. Yet within a week of the first case being notified, 25 people had been struck down by the disease. Hull was facing a crisis. On October the 12th, 1961, the Minister of Health announced that the vaccine could be used in the city. Thus, Hull became the first city in Western Europe to fight polio with the new oral vaccine developed by Dr. Sabin. This was the most sudden and most serious outbreak of polio in this country for over 2 years, and the job of fighting the disease fell on the city's health department. This is how they tackled it.
Polio outbreak. That was the ominous headline which faced the city of Hull on October the 5th, 1961. During the following week, newspapers in Hull and throughout the country pinpointed the alarming spread of the disease. The task facing the city health department was enormous. Speed was vital. The medical officer of health set the target: 300,000 men, women and children to be vaccinated in 1 week. The first job was to tell the people of Hull how and when they could get the vaccine. At press conferences, up-to-the-minute news was given, and soon the location of clinics was known in Hull and the neighbouring areas. 12 new cases of polio on the eve of the campaign gave it a grave impetus. Advertisements were placed in the local papers giving clinic times and places. Posters were prominently displayed in the city's shops. By noon of the first day, 150,000 people had been vaccinated. Supplies of the vaccine were quickly running out. The Royal Air Force stepped in. An aircraft from RAF Station Leconfield flew to Manston Airfield near to the factory to obtain these urgently needed further supplies. This was a cargo which received VIP treatment. Packed in special containers lined with dry ice, the vaccine was carefully and quickly transferred to a waiting van. From the airport, the van drove straight to the city health department. The staff had been alerted to receive the new supplies. Here, the crates were unpacked. Special care was taken to ensure that in the de-icing process, the inner containers with the vaccine were not damaged. If the vaccine had been kept in the containers, packed with dry ice, it would have remained frozen solid for another 3 days. Once it's removed, it thaws quickly, but retains its potency for about 7 days. In its frozen state, the vaccine is in concentrated form. Before use, it must be diluted. This is a simple procedure. First, the vials are spread out on a table, spacing them well apart to allow a free circulation of air at room temperature. And then they're left to thaw. When they've thawed out, the caps are removed from the vials. The rubber seals are swabbed with acetone. Now we come to the only part of this vaccination campaign which requires a needle. Disposable sterile syringes are prepared to inject sterile saline into the vaccine. The saline is injected into the vial. The other needle, pushed through the rubber cap, allows the escape of air and facilitates the process of dilution. Now the vaccine is ready for use. The diluted vaccine is repacked into the original boxes for distribution to the clinics. In a room below, the nerve centre of the campaign. From here, supplies of sugar, syrup and vaccination cards went out. Members of the health department staff answered a constant stream of telephone calls and took hourly progress reports from the clinics on their vaccine stocks. Where necessary, the ambulance station's shortwave radio was used to order the transfer of stocks between clinics. This clinic was in one of the 40 schools used for the purpose during the Hull campaign, and here the vials of diluted vaccine were opened for immediate use. A handful of sugar lumps and 2 drops per lump. The Lord Mayor of Hull and other members of the corporation took their sugar lump vaccine and obviously enjoyed it. 300,000 cubes of sugar were donated for the campaign by a well-known sugar company. For the very young, the under 5s, the vaccine was given in a teaspoonful of syrup. Like the sugar treatment, 2 drops of vaccine make the dose with syrup. The MOH made one special request: bring your own spoon. A simple point, but one which did much to speed up the process by cutting out any need for constant washing. Unlike most vaccination campaigns, there were no tears or tantrums. The children, with a superb variety of expressions, took their syrup and enjoyed it, with no idea that they and their parents were making medical history. Administration brought its problems. They were solved by a system of record cards collated and completed at the vaccination centres by members of the health department and volunteer workers. Even the mayor got one. Cards were made out for 4 different categories and in 4 different colours. For school children and the under 5s, for adults who had not received any Salk vaccine, for adults wholly or partially immunised with Salk vaccine, for non-residents of Hull. The people of Hull looked on the polio vaccinations as a family affair for old and young alike. While mother and son went to the clinic, father got his sugar lump at the factory or office. On leaving the clinic, everyone was given a form to hand to their own doctor telling him they'd had the vaccine. Voluntary helpers like this St. John's Ambulance Brigade worker were quick to answer the appeal for help. In all, more than 2,000 members of the WVS, Red Cross, Civil Defence and other voluntary organisations came forward. A strict rota system was arranged for every class at the city's schools. This meant that lessons were barely affected, and it also avoided queues. To speed up things even further, parents were asked to complete the card authorising vaccination for their children beforehand. the children, it was a peculiar grown-up game, but not for the nurses. As fast as they prepared the sugar lumps, they were gobbled up. In factories too, emergency clinics were set up. As with the schools, a rota system meant that lost working hours were kept to a minimum. This operator will be back at his workbench in a few minutes, and there's no sore arm to worry about. Protection comes with a few extra calories. But you need the vaccine on the sugar. Department stores make ideal sites for vaccination centres. It was an unusual break during the normal shopping trip. But it wasn't just shoppers who used the facilities. Anyone could come into the stores. Usually there was a short wait, then the formalities of the vaccination cards to be completed before the sugar lump with its vaccine was handed over. Over 15,000 people got the vaccine in one store, a tribute to the excellent cooperation between private enterprise and the local authority. For most of Hull's citizens, the vaccination campaign meant little disruption to their normal life. But for the Public Health Department, it had meant many long hours of work. How did the campaign work out? A month after the first case was notified, I met the Medical Officer of Health for Hull.
Doctor, as Medical Officer of Health for Hull, you've been the director of the first mass immunisation campaign with Sabine oral vaccine to be used in Western Europe. What was the object of this campaign, and do you say you've succeeded?
We'd hoped to give as many people as possible in Hull this vaccine, and I think that when I tell you that we gave it to 96.3% of the population, I think we can claim fairly that we have succeeded. We succeeded because of the tremendous response of the people of Hull to our appeals to come forward to receive the vaccine.
What were you really trying to achieve?
We were attempting to break the outbreak. We weren't attempting to vaccinate the people of Hull against all forms of polio. Our primary aim and object was to break this outbreak.
The organisation of such a campaign must have been a tremendous problem.
Yes, it was, but my task was made very much easier by the tremendous enthusiasm of my staff. As soon as they realised that they had a major problem on their hands, they all rallied, and I found amongst many of my staff qualities that I didn't realise were there. We were aided, of course, by the magnificent response of the various voluntary organisations in the city who rallied to our help.
So a great many people were involved in this campaign. You must have had a meeting early on to coordinate all their efforts. Who else apart from yourself was chiefly concerned?
At the beginning, the chairman of the health committee, the chairman of the local medical committee, and the consultant infectious diseases, together with senior officers of my department. We made the primary decisions, and then it was left to the department to run the campaign. At all the subsequent meetings, we had in the director of the WVS, who was of invaluable assistance to me throughout the whole campaign.
Other medical officers of health might well be faced with a problem like this. What special points of advice would you give them about administrative problems?
To ensure that there was very speedy communications between the various centres that are set up and some central point. An overabundance of transport, preferably radio-controlled. The necessity to keep the general practitioners in the area fully informed of all that's going on, and to have a bacteriologist either from the Public Health Laboratory Service or from the local hospital available to assist in the dilution of the vaccine.
Did you have to resist a strong tendency to panic?
All sorts of people would like you to make hasty decisions, but it's up to the medical officer of health not to be panicked. And it's up to him, too, to ensure that the public don't get a sense of panic, otherwise the campaign might get out of hand.
Any other special points you noticed?
Yes, we had some difficulty with the droppers that were supplied. They were supposed to supply 0.1 milliliter in 2 drops, but in effect they didn't. And it's a point that medical officer of health should take note of, because in planning their campaign and the amount of vaccine they require, it can materially affect the supplies of the vaccine.
Did you divide the people into categories?
We had 4 categories in Hull: children under the age of 15, people over 15, those who had some sort of vaccine, those who had none, and then we had a 4th category, people living outside the city.
Did you record these categories on cards?
These were all recorded in cards, but that was one of the weaknesses of our system, and I'm sure that before anyone attempts a campaign such as we had in Hull, they should try to devise some punch card system, because it will make the task of counting the cards and the separation of the various groups very much easier.
Did many people come in from outside the city for vaccination?
Of the 360,000 people we vaccinated, over 60,000 were not Hull residents.
So in any future outbreak in a city, the number coming from outside might be quite considerable.
I can well imagine in some of the large conurbations it would be a real headache to the medical officer of health whose campaign it was.
Did you have many doctors involved in the campaign?
We had all the medical staff from my own department. The idea there was that they should go around the clinics and answer questions from people who would come up and say, is it all right for me to have the vaccine? But in effect, once the campaign got going, we found that they weren't really necessary, because more or less everybody who could stand on their 2 feet were given the vaccine.
Well, you must have found that nurses were very necessary. How many of them did you have?
We had 145 nurses, many from my own staff, but lots of nurses who had retired or who were married phoned in and offered their services, and of course we readily accepted it.
You used a number of mobile clinics as well as the static clinics at schools, hospitals, factories and so on. How did the mobile clinics work out?
They did excellent work. They went to factories and shops where we thought it would be profitable from the number point of view to send a mobile team, and we had utmost cooperation from factory management and from the shops too.
You call them mobile teams?
I prefer that name, because it was a team that went out to the various factories and shops.
I understand you used type 2 vaccine in this first campaign. Does this give long protection?
The type 2 vaccine which we used will offer a long-term protection against type 2 and a short-term protection against types 1 and 3.
Briefly, Doctor, what conclusions have you come to about this new oral vaccine?
This new oral vaccine has 2 main uses. The first, to use it as we did in an emergency to break an outbreak, and secondly, to use it as a long-term measure to protect the community as a whole against poliomyelitis.